ABC6 health specialist Ileana Bravo went in the operating room to see exactly how this procedure works. I want to know.
It's pretty cool, and it's the latest treatment to get rid of this so-called unwanted fat, especially in areas that plastic surgeons couldn't get to before. Now, this is the new kind of liposuction that indeed does melt fat away. The patient is a middle-aged woman who wants to get rid of excess fat on her hips and upper thighs, the areas marked in these photos. Surgeon Stephan Baker chooses her as his first patient for a revolutionary new treatment to eliminate fat called ultrasound-assisted lipoplasty. He shows us how it works using a small bit of human fat.
Make the fat sort of bubble and then causes the fat to melt down.
Unlike traditional liposuction that forcibly vacuums out excess fat, the ultrasound wand uses mechanical vibrations to literally zap the fat into liquid form and then washes it out.
That's one of the main ideas behind this, to liquefy the fat and leave the surrounding structures intact, so there's less tissue damage.
And that means less bleeding, less bruising, quicker recovery, despite the fact that it is a full operation.
And I'm barely using any force at all. This instrument is just sliding through the fat without any effort at all.
One of the advantages of this procedure, according to the experts, is that because it cuts down so much on bruising, this patient can be up and about in around a day or so. Though the patient does not require general anesthesia, she is heavily sedated but goes home hours after the surgery. Now she'll wear a special girdle for a month to help the skin surface adapt smoothly to the reduced fat volume. In tests on 500 patients nationwide, Lysonics ultrasound lipoplasty was found to be effective in getting rid of more fat than traditional liposuction because there's less blood loss. And of course the results vary patient to patient, but they're supposed to be at least equivalent to traditional liposuction. The cosmetic surgeon using ultrasound lipoplasty must be trained and certified by the company.
So if you're going to have the procedure, you don't have to look at what we just saw.
No, you don't.
That was a little unsettling, but,
yes.
Are the people happy with the results?
So far they're saying that it's amazing because they can get rid of more fat quicker at one time, whereas with the traditional liposuction, because of the blood loss, etc., they could only do a little bit at a time. But this allows the physician to really get in there and get more fat, so the patients love it. And they don't see any of that fat that I hope we didn't offend you at home.
Okay, Ileana,
Thank you very much, Ileana.